Many are wondering, if we've been told shelter in place, do not go to the supermarket, don't even go to the doctor unless it's absolutely necessary, then how are we keeping women's mikvahot open? So much of what we read seems to reinforce that there's so much more we don't know. Even if we know a lot about COVID-19's cousin SARS-1 and its distant cousin influenza, there's so much more we don't know about this current virus than that we do. If we've gone so far to shut down all communal religious activity, given the sacrosanct value of protecting human life, why are we keeping women's mikvahot open? To understand this more, I interviewed Dr. Dina Zimmerman. Dr. Zimmerman is a member of Israel's Ministry of Health's Public Health Service. What this means is she is intimately involved in the public health decisions that are being made in the state of Israel. She is also a veteran Nishmat Yoetzet Halacha, and she runs yoetzot.org. So Dina, welcome. Given the halachic imperative to protect lives at all costs, why are we keeping mikvahot open?
The answer is very simple, because it is safe to keep it open when they are maintained and operated under the proper conditions.
So explain to us, please, why is it so important to work with experts in public health when addressing this question? Why shouldn't we consult maybe a regular epidemiologist or a virologist to make our decisions about the mikvahot?
Because public health is its own specialty that is designed for dealing with issues of populations, not just with individuals. Dealing with outbreaks, dealing with epidemics is exactly what this specialty is trained to do. It's also a multidisciplinary specialty, which means that one has access to people with specialties in public health, not only physicians, also people who are experts in environmental health, water safety, and other specialties that come in and can help answer our questions in the best possible way.
So talk to me about the different kinds of techniques and tools that public health experts use in containing any kind of outbreak, epidemic, pandemic.
Okay, so many of these are probably words that you've already heard before. The simplest one and the most basic one is hygiene. All right, most diseases are spread between people, and basic hygiene can make a difference in terms of how it's spread. There is also the issue of containment, quarantine, and social distancing.
And how would these different tools apply in a mikveh setting in a way that keeps mikvahot within the bounds of public health concerns?
Okay, so first of all, proper maintenance and cleanliness of the mikveh is preventing women from many different diseases that can be passed from woman to woman, and is something that should be done at all times, not related to corona as well. Because of the corona epidemic, we've added the issue of making sure that women who are sick, in quarantine, have symptoms that may turn out to be corona, should not be using the mikveh. And by keeping sick people out, we are keeping other people from having the possibility of being sick. Now that the epidemic has gotten more serious, we are also using the issue of social isolation, keeping people away from each other. And if you are not close enough to the person to be able to have the disease spread to you, primarily by droplet spread, which is about 2 meters, 6 feet, then you shouldn't be able to get sick from that as well.
But Dina, I keep reading about asymptomatic carriers, and people have even raised the theory that people might even be more infectious before they actually show symptoms.
Okay, people have been raising the possibility, but this has not been what we are seeing clinically. Okay, many of the studies that talked about the viral load that an asymptomatic person may have, if you read them carefully, isn't necessarily talking about asymptomatic people, it's talking about minimally symptomatic people. And that's why we're being very careful that if a woman has signs that aren't necessarily sounding like corona, she should not go to the mikveh that night, and she should just wait a day or so to see, oh, it really just was a cold that just went away, and not, oh, this was really the beginning of something else. That's yet another level of preventing people from getting sick. We also have to realize that the amount of virus the person has doesn't necessarily mean the amount that he is spreading and getting to other people. And by keeping social distancing, even if you are in the same universe as somebody who has the virus, if you are far away enough from them, he's not going to spread the virus to you.
Okay, so you're most concerned about droplet spread. That is what you are saying. Okay. So there was a study released by Israel's Ministry of Health last week that said that 1% of patients were infected at the mikveh. What does that mean?
Okay, so to understand that study, one actually has to look at the actual numbers that they were talking about. The authors of the study, or those who published the study, because the full study, is not what they've sent around on the internet. They just sent around one table. But even the authors of this point out that these numbers reflect what was happening before social isolation and other kinds of restrictions were being put in place. And at that point, they found that there was one case of a mikveh where spread happened. It says nothing there in terms of it happening specifically from the water. Most likely it had to do with spread from person to person being in the same place. It also doesn't mention if it's a men's mikveh or a women's mikveh, and there's a very big difference between the degree of hygiene that is usually kept in those kinds of mikvahot. For that reason, all the men's mikvahot in Israel have in fact been closed, while the ministry is keeping open the women's mikvahs, because we really understand it's not the same thing. Also, the preparation for using the mikveh between men and women is so different. Men come in, get undressed, and go in. Women are coming in the cleanest possible fashion a human being could ever be. And it also is really important to realize that they rounded off the numbers. Okay, there were 245 cases in that study. If you do the math, it actually comes out to 0.8%. And I think the most important thing is that the use of this study, by taking that 1% and extrapolating it to the number of cases we have now, is not legitimate, because we're only talking about, one case out of 245 in a totally different situation. So I think that study is interesting, but doesn't really contribute anything to the mikveh issue. It does contribute something to the shul issue, because there were, I think, about 29%, close to 30%, where the spread happened in synagogues. And that is why the community policies to close shuls, as painful as it has been and as difficult as been, is so crucial in preventing disease spread.
Got it. So in light of what you just explained, can you explain to me why my hometown of Efrat recently, there was a case where a woman immersed, and then she was later found out to be a carrier. And this caused, understandably, some panic. That's putting it lightly. And all the women who had immersed that night were told to quarantine. Why were they told to self-quarantine if the mikvahot are safe?
Okay, because there the concern was not the mikveh water. There the concern was women who had been in the same space with this woman at the same time. Because at that point, there was no way of knowing exactly what time this woman came out and other women came in, the decision was made to do it the entire night. Now, when we're working by an appointment system, then that scenario should not repeat itself. There may still be some people who need to self-quarantine, but it would be, one or two women who might have overlapped with her coming in, and not everyone who used the mikveh that night. I think it's also really important to realize what the tool of quarantine is. Being put in quarantine does not mean that you are necessarily get sick. and many of the people will not and did not get sick, but they have enough of a reason for us to be concerned that we want to stop it and take extreme measures, mostly to make sure they're not going to pass it on further.
Got it. So Dina, why are you so convinced that mikveh water itself does not pose a danger?
Because the coronavirus has been around already for over 3 months. Many studies have been done on the virus itself. The virus itself is not such a sturdy virus, and we know it is killed by chlorine and bromine and bleach. And therefore, I am convinced that the amount of chlorine that is put into a mikveh standardly, because that is how we keep water that is used by more than one person safe. It has standards, and those standards that are used routinely are sufficient and more to kill the coronavirus.
It's really insane that such an unstable little virus is wreaking such havoc on this universe. And so what you're saying, just to me, be very clear, we know this about this current SARS / what is it, CoV-2, and it's not based on stuff about cousin SARS-1?
No, the things that I'm saying about this virus being able to be killed by chlorine is relevant to this virus.
Okay.
It's also relevant to the other one.
So then why are public pools closed?
A public pool is a totally different situation, okay? The main reasons decisions were made to close public pools is because they're a place that people congregate, and we want to close places that people congregate. A mikveh, working by appointment, that the women are not going to be too many people there at the same time, is no longer a place where people congregate. Furthermore, any studies that are done about public pools or public baths are not relevant to mikvaot because many of you have used pools. There's a nice sign there that says, please shower before going into the pool. And some people do, some people don't. And even if they do, it's like a quick rinse off. That's completely different from the amount of preparation and scrubbing that women do before they use a mikveh.
Got it. I learned a new word. It's called fomites. That's a fancy word for surfaces. Could you talk to us about fomites? It's not just droplets, right? Meaning those droplets can go onto those fomites, right? So how do we prevent spread from fomites?
The way that we prevent spread from surfaces, okay, and I know there have been a lot of studies out there that have shown how much the virus can live on plastic, on wood, etc. But that's not really what's relevant in terms of causing disease. Because in order to spread it that way, one has to touch it, not wash his hands, and then touch the respiratory area. So even if they are there are things that can be put in place to prevent that from spreading disease. And those things are hygiene, washing your hands, wiping down surfaces, not touching your face, your face and that. And that's good practice, okay? In a time of an epidemic, we want to do every little bit that we can to prevent the spread. But the main way it is being spread is by droplet spread. And the way to deal with the fear of surfaces is not to give into the fear, but to be more careful with hygiene than we might be on a day-to-day life.
Okay, so that is why at Nishmat's special portal on the novel coronavirus and Taharat HaMishpacha, we offer a lot of suggestions of how to further minimize any kind of contact with fomites. But these are suggestions, right? Meaning these are suggestions to protect, but not that there is an inherent danger here, right? What I'm hearing loud and clear from you is that social distancing and hand washing those are the number one ways to prevent
yes,
contracting
yes.
the disease.
Yes.
Okay. So what if the mikveh attendant did not wipe down the surface when I get to the mikveh? So what if I touched the sink in the prep room and the person before me was positive and she touched that sink also and now I have the fomite, and I didn't
Okay,
wash.
so first of all, you hopefully washed your hands, because that's what we're saying to do. You've also gone into the mikveh water, which will wash it off. And the amount that was probably left there was a small amount of viruses. And we have to keep in consideration what it is that makes us sick, okay? One virus particle is not going to make a human being with a normal immune system sick. It takes a certain amount of viral load to make them sick. We don't yet know the exact number, and it's probably not one number. It's a matter of balancing the number of viruses and our immune system, because every single viruses on surfaces that we are touching, we have bacteria, we are not living in a sterile world, but we are designed to be able to deal with it, okay? So a small, occasional, maybe I touch something, the chances of getting sick are extremely low. The way to keep that in my power and do what it is that I can is wash hands. I touch something, I wash my hands. I'm not sure they wipe down the surface and I'm really nervous. Wipe it down yourself and wash your hands, okay? So I think the issue of surfaces is something that can certainly be brought under control, and one can immerse in a way that makes one feel comfortable. The degree that you want to take our advice about different ways to do it will depend from person to person, but the main emphasis we should be putting is the issue of social distancing, making appointments, and basic hygiene and cleanliness.
Okay, but if somebody's immunocompromised, then their system may not be able to handle even a smaller viral load.
That is why women who are immunocompromised should be talking to their doctor before they go out, before they go to the supermarket, and before they go, they go to the mikveh. And it will depend from women to women. There are different levels of immunocompromise, so everything has to be decided on individual level. One of the possible suggestions might be for the woman to be the first person to immerse, and therefore the chances of anybody possibly touching anything is even lower. This is the kind of advice that we often give to women who are immunocompromised, not related to corona, okay? Just about the possibility of picking something else up in any public place, not just the mikveh. But this is something that people who are worried about their immune system should be discussing with a doctor. It's very important, though, that the doctor understands what really goes in a woman's mikveh, particularly today, okay? A mikveh is not the same as a public pool, and decisions about what to do should not be based on swimming pools. It should be based on the understanding this is only clean women who are going into well-chlorinated water. Each woman immerses by themselves. It is not a group immersion. And the water is kept with chlorine to, proper standards.
Okay. The next issue of concern here is there was a letter to the editor in the New England Journal of Medicine, which has raised some alarm bells for many. And they're wondering whether the humidity in the mikveh room might lead to an even greater concern about airborne-like conditions. And that means that an infected droplet might hang around in the air longer than in other non-humid conditions and then transfer disease. How would you address this concern?
Okay, so first of all, reading that letter, one has to realize this was experimental conditions. They purposely took the virus, took a machine, made steam, put it in the room to see how long it was going to live there, all right? So that is not necessarily the same thing as one person who may have given one cough or touched one surface. It can't be compared to anything in the usual day-to-day. The only thing in real life that's somewhat similar to that is hospital ventilators. And that is something that, things are being put in place to prevent that aerosol spread in terms of protecting healthcare workers. But in terms of a regular mikveh, I am not concerned because the viral load here is so long. And also, it's the amount of time that the woman is going to be in there. because in order for you to get it from the air, which once again, in terms of real life, where we're seeing it spreading, that does not seem to be the main place, certainly outside of a hospital setting. But if you're in and out in 10 minutes, the amount of time that you're exposed to the air is much less. And to even make the possibility lower, then, just to work on ventilation of the area.
So what do you mean, like opening a window?
I mean, like opening a window, and I realize that some, mikveh areas exactly don't have a window there. So open the window in another room and open the door to the mikveh between woman and woman, okay? By spacing women out, we're giving time for ventilation, we're giving time for cleaning, and, even if the virus lives longer because it's human, it's still not long enough, and I'm not going to be in there long enough for me really to be worried about that's what's going to make me sick.
Okay, so based on this and our discussion of viral load from before, I'm actually much more concerned about the mikveh attendant's health than about the woman who is very quickly getting through that prep room because she's done all her prep at home. Again, see our website for all of our recommendations. And then she's very quickly entering and exiting the pool room. I'm much more worried about the mikveh attendant.
Okay, so there is reason that communities should be thinking about what's happening with their mikveh attendants. First of all, making sure that the people who are coming to the mikveh are not women in quarantine. Putting a sign on the door, if you're in quarantine, do not come. Empowering the mikveh lady to tell women that, it sounds like you might be sick, please come back tomorrow. And make it very clear in our communities who is not allowed to use the mikveh, doesn't matter what the personal circumstances are. That is probably the most important thing that we are doing to protect the mikveh ladies. Other things that the fact that she's only seeing one woman at a time helps to some degree because it's not a bunch of people all coughing in each other's faces. And when she is taking care of the woman themselves, there are things that should be put in place now to make the risk less. There's no reason she needs to be close to the woman as she's going down. Her role is to see that her hair goes underwater. This can be done from a distance of 2 meters. All the things that mikveh ladies do, which are based on custom, such as, checking her back, are not necessary from a halachic point of view, and therefore for almost all women this can be a touch-free process. In the case where she needs to assist a woman who really can't walk down the steps or something, then providing her with gloves and a mask and some sort of gown for those specific circumstances, another thing that we can do to protect her. Keep the mikveh well ventilated, as I said, and maybe in very busy mikvahs, think about the possibility of taking shifts. And therefore, the amount of hours that she's staying there will be one woman, will be less per woman. I also think that there is a point to think about who we are using as mikveh attendants at this point, that we should be using younger women, women who don't have underlying medical, conditions, and think about, who should be the mikveh attendant and protect her in that way.
Would you even say she doesn't even need to be in the pool room herself? Meaning as long as she can be standing in a separate room and as long as she can see the woman's hair under the water, that would suffice. Right. She could be standing in a different room.
Absolutely in most cases, except for those cases that women need physical help to get down the steps, and then that can certainly be done.
So today's news, where we heard that there was a mikveh attendant in one of the cities in Israel who was found to be a carrier, but what I understand is there wasn't yet an appointment system, and all of the women were told to self-quarantine who had been exposed to her. I am very hopeful that that city very quickly institutes the now mandatory appointment system, and that could have avoided that amount of women having to go into self-quarantine.
Correct. And I think another thing that comes out of that case, which I don't know all the details about, but we need to also make sure that the women who are working as mikveh attendants, if they are sick, they have the right and they should be calling in sick. And they should not feel that, oh my gosh, I want to do my job. This is a time, really, if you're not feeling well, it's better, safe than sorry.
Yeah, there's definitely a lot of education that needs to go on now to bring as many places into compliance as possible. That's for sure.
Which, by the way, is going to help in terms of preventing lots of disease spread. Okay, so it's a wonderful thing. So something good may come out of this epidemic as well.
Bezrat Hashem. Could you see recommending that a woman wear a mask until right before her immersion and put another one on right after?
Okay, so based where things are holding at this point, that does not seem to be necessary, because once again, the fear is not the airborne spread. I think one of the things that the mask does help with a little bit is it reminds you not to touch your face and your mouth, okay? But I think that that's something at the level of individual choice, all right? If we get to the point that the recommendations change that everybody has to wear a mask in a public place, then it's very important to listen to whatever guidance is being given at that point. But until that point, I will leave it to the individual woman. She wants to do it, let her do it. She doesn't want to do it, I wouldn't make her.
Okay. So given all of this, would you recommend that a woman who is on hormonal contraception space out her mikveh visits, obviously assuming her physician approves of that, by taking extra pills?
I think that's really an individual choice, okay? The woman herself may decide, I just don't want to deal with this, give me a chance to deal with it less, and that's perfectly fine. I don't think I would say that there needs to be a public policy, because the mikveh is not an unsafe place to go, okay, as we've been saying here a number of times. And I think it should be, individual decision, not policy for everyone.
Meaning it's just to prevent her from needing to go out of the house more than she has to. Okay. Yep. Any advice for highly trafficked mikvahot? Meaning, how would a mikveh that sees maybe 40 women a night maintain these really intense new standards?
Okay, I think it's a matter of advanced planning. Okay, making appointments makes a real difference. Women who are preparing at home and coming down and just dunking, one can get in a fair number in an hour, even with the strict guidelines. Okay, I think there is room for halachic work here in terms of making it possible for women to immerse as early as possible, okay? Even though we very often wait till actual nightfall, there's room for some slightly earlier than that. And there's also room for halachic discussion about the possibility of using the mikveh the next day during the day on the 8th day.
All right, so then you're spacing out and creating more room for more women.
Correct.
Which might be necessary in a place that maybe sets a curfew anyway.
Also true.
Okay. And what about if there really is a very serious local outbreak? Would you potentially recommend closing a mikveh in such a community?
I think that's something that needs to be dealt with the local authorities, okay, and know the details of that specific case. But if it does turn out that the reason there's an outbreak and these guidelines are not being followed, then I most definitely would close the mikveh until such point as they're willing to run it in the way that it needs to be run at all times, and even more so now.
So you've really explained to us how the measures that have been taken by responsible rabbinic organizations, I know of the ones in the United States and individual mikvahot in the United States, and followed by the strict tightening of measures by Israel's Ministry of Health, they really do support keeping women's mikvahot open to the public under these strict standards. What if a woman goes in and she sees, oh my gosh, this mikveh is not keeping to everything that Nishma told me it's keeping to? What do we do? What should she do?
Okay, so first of all, yet another advantage of making appointments is it gives somebody the ability to ask some of these questions the night before, okay? And if she's not comfortable with the answers that she gets, to look for other alternatives. If for some reason she wasn't able to do that and she shows up at a place that really makes her uncomfortable, then she should not immerse and try to find another solution, even if it means slightly delaying.
Right. So given all of this, is it still legitimate for an individual woman to decide that she might want to delay immersion in the current pandemic?
I think under all circumstances, it is legitimate for a woman to delay mikveh if she's not comfortable with what is going on. It's important, although, that she realizes what the consequences are in terms of prolonging the time that she's not able to have physical contact. But I think it's also very important that we are keeping the mikveh open for those women who do choose to use it as a community. Okay, it's very important to leave the choice open, and what an individual woman decides, that's her right.
Got it. Dina, thank you so much for your time.
All right, you're very welcome, and let us end with hoping that Avinu Malkeinu Mina Magaifa Minachalatenu, and may this be the end of, may this epidemic end quickly with as few victims as possible, and may Pesach really be Chag Latenu, the time of our redemption.
Amen. Thank you so much.
You're welcome.